home remedies, personality, etc., and rumors have resulted into complete state of confusion for a common man, what to do and what not to do. Keeping all above in mind, today's webinar has been planned exclusively for the employees of the center and general public. All we need to know what is COVID-19. I am sure those who have joined this webinar will be immensely benefited with better knowledge and more aware on this subject, which can with carry home message, health and safety for all. With this, I thank you one and all, and now over to Dr. Rakesh and Dr. Sonu.
So thank you, Mr. Arun Verma, and thank you, Dr. Goyal, for joining us. And it's a pleasure to be with all the employees of Trenta. So Mr. Rajat, he talked to me that we should have this kind of webinar. And Ms. Nidhi, she is the HR person, and Mr. Bhupinder and Captain Atul, they were all in touch with me regarding the webinar. So thanks all. So next. So this is the overall picture of the COVID. As you see, the coronavirus, it's a very tiny virus, and it has got set of genes, proteins, and a fatty membrane, and it attaches itself to the surfaces, especially the lungs. Next. So these are the normal symptoms: sore throat, confusion, headache, shortness of breath, cough, fever. But nowadays, some more symptoms like tiredness and even vomiting, diarrhea, they present before the other symptoms they cough. Next. So this is the kind of masking which is now recommended. So if you can't use that N95 because the breathing is difficult with the N95 mask, you can use this double masking. So there's a surgical mask underneath and there's a cloth mask over it. Next. It protects you, 85% protection is there. So it says that to avoid that kind of mask, the oxygen mask, you wear this mask. Next. So as we all know that smoking, that affects our lungs, right? So any kind of tobacco, in fact, the hookah smoking, bidi smoking, or cigarette smoking, even the vaping, as you know, some people, they use those electronic cigarettes, though they are banned in India. So they are all harmful, and they increase the severity of the COVID. Even that chewable tobacco, because with chewable tobacco, you tend to spit a lot. So spitting also that spreads infection. So we must all shun the tobacco. If anybody is in the habit of using tobacco, that you must shun that habit now. Next. Next. So we'll be sharing these presentations with you. I mean, this recording will be shared, so you can just have all the details you want, right? So the mild, as we say, the mild COVID, it is the SpO2, that is oxygen level. First thing is that if you suspect that you are suffering from COVID, I mean, if you have sore throat, fever, or even if you are asymptomatic but in contact with a COVID person, then you must record your temperature, your oxygen level, and your pulse. That should be recorded regularly. And it is called a mild condition if that oxygen level is more than 94% in room air, and the respiratory rate is less than 24. You have fever. The chest X-ray is normal. CT chest, if it is affected, it is normal, or it may be less than 25% affected. And some of the laboratory findings, though I don't recommend laboratory tests for all the patients, but if you get tested, these are the findings you will find in your test reports. Next. So as I told you, that monitoring oxygen level, heart rate, temperature, rehydration is very important. You must keep yourself rehydrated, plenty of fluids. It may be in the form of lassi, it may be form of the lemon water, it may be in the form of nariyal pani, so that you must take in plenty. And if you have fever, then antipyretic, those Crocin or Dolo, that can be used. Nutritional support is important. In addition to the good healthy diet, you must take vitamin C plus zinc. Limc zinc is available. You should take some multivitamin. Supradin is a cheap alternative, very economical, and it contains all the vitamins. Vitamin D, D3. So either you take 60,000 units for 3 days together, or at least once a week you can take, right? Then there is actually, now it is found there's no role of azithromycin doxycycline, but at all, if your doctor recommends, you may take azithromycin and doxycycline for 5 days. But as far as ivermectin is concerned, it has been proven that it doesn't have any role. Next. So I don't recommend tests for all the patients, but at all, if you want to get the test done, there is one RAT, which is called rapid antigen test. If it tests positive, then you must consider it as positive. And if it is negative, then we can go in for the RT-PCR test. Next. So these are some of the guidelines from Government of India. They're the very latest guidelines. They were issued on 28th of April. So Dr. Sonu, can you just talk about these guidelines, some guidelines?
Yes, thank you. Thank you, Dr. Rakesh. So I think it's a wonderful gathering. So we have been usually have the gathering of doctors, but this time I think we have a different gathering, and this is really useful because general people would like to know about certain things, and you as a I think you can circulate this among your family, among your peers. I think I'll continue with where Dr. Rakesh left and want to reiterate one fact about, because many people used to ask, when should we go to the hospital? So that is one important question which comes to our mind. So Dr. Rakesh has emphasized that when the oxygen level, because everybody who is having fever or something I recommend that one should buy one oximeter. So that oximeter is available in the market. So that can be, because that's the only measure where we can see the deterioration in our health. So that is applied to your finger and you can measure the oxygen level. So I think if the oxygen level goes beyond 94, then you should be cautious. When it goes beyond 90, so then I think you should think of going to the hospital. But that is a measure which is very important, which you should. The second thing is when a person is having a COVID, normally the person cannot hold his or her breath. One can breathe in, but when he or she is being told about holding the breath inside, he or she is not able to hold it to a great extent. So that is another simple test, which by holding the breath, so you can test whether you are suffering from COVID, and the severity of the COVID will also be assessed through that. And there are multiple symptoms now, and all atypical symptoms: loss of taste, loss of smell, but now conjunctivitis, even eye problems are there, diarrhea, and a lot of other things can be there. But fever is like the common one. And then if any of these symptoms are there, then you should suspect and one should get it tested as soon as possible. So that is important, to get tested. People fear that if I get tested, then if I turn positive, then I'll be confined to the home or this thing. But in that case, you are saving not only yourself, but also your family members, because they also come to know about your status, and they can isolate themselves. You can isolate themselves from them so that they are safe. And you are also reducing the transmission. So that is briefly about what has been said. So these are some of the latest guidelines. This guideline has come, I think, a day before, about what I was telling. Lab confirmed cases, asymptomatic cases. What should be the revised guideline for home isolation? If you are asymptomatic, no symptoms are there, but in a lab confirmed, you have a oxygen saturation of more than 94. So you need not worry. Basically, you should keep yourself at home and just maintain that home isolation. Next, please. So this is what you need to do during home isolation. So this is another common question, that if somebody in your family turns to be COVID, so what should be done? So a simple thing is, he or she should be given a separate room, and as Dr. Rakesh has told, double masking. So now people are saying we are 3 masks, but at least 2 masks and 2 surgical masks, not cloth-based masks. So what cloth-based masks are not effective at all when you are in a high this thing environment, because if somebody is suffering from COVID in your home, then you should wear that surgical masks. So then second thing is how to take care of the person who is suffering from COVID. A communication link is really required. What people do, they isolate the person in one room and they don't talk to them. So talking with them is really important, because that will give them the confidence, because people lose confidence when somebody is suffering. So how to talk? The only thing is we can't go physically and physically talk. So maintaining the social distance, again, there is some fear that there might be a possibility, but you can use your phone, your device, so then you can talk. When you're giving food, so you can give the food, you can keep the food outside, and then the table can be kept. So basic idea is you should all maintain that that distance of 3 feet. Actually, it is required, and you should have that mask, and you should wash your hands properly. So you should wash hand multiple times, because, and another thing which I usually tell is, normally this virus is usually like it is the nose or the mouth which is the main entry of the virus. So we should make a habit actually not to touch our nose and mouth more frequently. So that is a common thing which we can do and make it as a practice, because it's not only about COVID, but other viral bacterial infections. Some infections are because of when we are touching our nose, mouth very frequently. So this is one thing which we used to take precautions on. And the elderly patients, age 60 years and above, and those with comorbid condition. I think you have been listening to newspapers like TV and reading the newspaper, that those suffering from hypertension, diabetes, heart diseases, cancers, so they actually have lower immunities. So they should be very taken care of very meticulously if they are suffering from COVID, because they can deteriorate rapidly. So their monitoring and everything, as I told, is, but you don't have to panic, as was shown in the video. Don't have to panic. You should keep them isolated and follow all precautions and monitor by oxygen level and by the holding of breath, what I told. Next, please. So this is what I already told you. I think one should wear the triple layer medical mask. This is what is there, medical this thing, and discard mask after 8 hours of use. So basically surgical mask is having the triple layer. You can't see that, but there is a triple layer within that one mask. So that is why this is more preferred over the normal mask, the cloth based mask. And the mask should be discarded basically in 1% hypochlorite solution. So if somebody is suffering in home in COVID, so then this solution should be there. And as told that we should drink a lot of fluids, and eating of fruits and all those things are really important. Next, please. So I think I told you about frequent hand washing, that respiratory etiquettes, like we should not touch our this thing. And again, one more precautions, when you are going to any market or your office even, so try to minimize touching the surfaces. Although by surfaces, long time back, I wrote in newspaper that surfaces, even that virus remain for 48 to 72 hours. So that is important, that we should not, although there is not much evidence which has come that people have been infected through surface contact. Normally it is respiratory contact, but yes, there is every chance that, so that's why minimize the contact with any surface. If you are traveling in a lift, so try not to hold lift. So if you are sitting, try not to touch tables and this thing. So this is really important. And the temperature monitoring is also important. You are doing blood oxygen saturation with the pulse oximeter, but temperature recording. So if the temperature is going up 101, 102, So you should be cautious. Next, please. So I think this is this. You should take this photograph of this, or we will be sharing that presentation with you. This is basically about monitoring what all to monitor. Temperature, I have told you, if temperature monitoring and day by day, every 4 hourly, if you are monitoring. So if the temperature is going up, 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 if oxygenation level is going down, 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 and if you are feeling breathlessness. So then again, these are some of the signs where you need to be cautious and go to the hospital. So I already told you about these instructions for caregivers, so maybe we can skip. And this is about, yeah, this is important because nowadays there has been an indiscriminate use of many medicine, including remdesivir. I think many controversies are there, and there are other drugs also, tocilizumab, remdesivir, and these are many drugs. So again, these are the drugs given in only hospital settings because they cause more harm than it is being used if they are used in the home settings, because there are multiple symptoms basically, like many side effects which might happen if you are using this tablets at home. Again, even if oral steroids, that has to be taken again after consultation with your physicians. So I think the only thing which you can do at home is monitoring of your temperature, monitoring of your oxygenation, monitoring of your respiratory rate. So these are the 3 monitoring which you can do, and symptomatically you can only give yourself a paracetamol. That's the only thing which we can do. And these are warm gargles, taking steam inhalation. This can be done, but there is no proven this thing, this will be able to cure COVID. Next, please. So I think I already told you these are where when you should seek medical attention, difficulty in breathing, especially outside, when you're breathing outside, not inhaling, exhaling. So not able to hold breath. Dip in saturation level, 94, yes. But again, immediately when it goes to 94, don't rush to the hospital. It is coming in the moderate. So 90, 92, then you should rush to the hospital. But that plan well. If there is a mental confusion, because that is really important, and pain in the chest, and these are the things when you should have actually consult your physician and go to the hospital. And this is important. Last line basically is 10 days of isolation is important. If somebody is having symptom and confirmed COVID, so 10 days he or she should be isolated within the home, and no fever for 10 days. Suppose it's 11 days, but the fever has not gone. So you should consider again isolation. So if it is 12, 13, 14 days, so then there is no fever. So then 14 days of isolation should be there. So 10 days and no fever for 3 days. So this is how the isolation period is defined. And there is no need of retesting. People used to retest again after 14 days. No, it's not recommended actually. Next, please. So I think now Dr. Rakesh want to take over. You are muted, Dr. Rakesh. You are muted. Dr. Rakesh, you are muted.
Okay. So am I audible now? So thank you, Dr. Sonu, and for sharing the guidelines. And this is how the oxygen can be improved by putting yourself in a prone position. So can you play the video? Arshdeep, can you play the video?
To tell you about the prone breathing technique. This technique will help you to increase the oxygen level of the body, and this will maintain the saturation level of the person. So I'll tell you how to do the prone breathing technique. So you need to have pillows with you, 3 pillows, or you can even have 4 pillows, so that you can keep the 2 pillows at your chest level, and 2 pillows you have to rest 2 pillows. I'll tell you once I lie down, you can see where you have to put. So you have to be in a prone position. Your neck should be out of this. Your hand, one hand should be here and the other must go down. This should be at the palmar level, and this and the pillow, this pillow should be up, and the ankle should be in dorsiflexion. And then you have to breathe in and then breathe out. Breathe in, breathe out. Breathe in, breathe out. All right.
So you have seen that actually I have practically seen that you can improve the oxygen level if you use that that oximeter on your finger, and you can see how much it improves. So this is what Dr. Randeep Guleria, he is the director AIMS, he has to say. So the important thing is, as a country, if we work together, use oxygen and remdesivir judiciously, then there will be no shortage anywhere in terms of number of people who need oxygen and oxygen supply. We are well balanced. Actually, there's not much of shortage of oxygen and the medicines, but we are just panicky about it. So oxygen is a treatment, it is like a drug. And taking oxygen intermittently is an absolute waste of oxygen. You have seen those lungas of oxygen. So they may not be very helpful in the long run, because when the oxygen is required, it has to be, you have to be hospitalized properly and then get it in a continuous form till it is required. So the vaccine prevents you from getting the disease in the form of severe illness. So as far as the vaccine is concerned, he says that it is not that if you are vaccinated, you won't have COVID, so it can't prevent reinfection, but the severity of the illness will definitely decrease. Next. So Dr. Devi Prasad Shetty, he is chairman and executive director of Narayan Health. So he also says that if your oxygen saturation is above 94%, then there's no problem. But if it is failing after 6-minute exercise, then you need to call a doctor. It is important you get the right treatment at the right time. So as I think Dr. Sonu also touched upon this point, that you put on that oximeter and then take a walk for 6 minutes and then watch how much percentage it decreases. If it decreases by 3-4 points, then it is cause for worry. Otherwise, there's no issue. If it remains more than 24%. Next. So you know about Dr. Naresh Trehan. He is a very senior cardiologist and he is in Medanta presently. So he has also the same views, and he also says that remdesivir is not a Ramban. So you have to use it. The oxygen, all the medicines, you have to use it very, very judiciously. Only when a doctor prescribes. Next. So this is about the remdesivir. So can you play this video? These are the myths and facts about remdesivir.
Hello everyone, I am Dr. Sridhar. I'm a consultant in critical care and I head the ICU at Kaveri Hospital, Chennai. During these difficult times, one of the most common questions I'm asked about is the availability and value of the drug remdesivir. Now, I deal with the sickest of the sick patients, and as we all know, most patients who get corona get better on their own. 98 to 99% of them require nothing more than home isolation and occasionally a tablet of paracetamol to treat the fever and body ache. Most of them get better on their own. For the ones that get sick and get admitted to hospital, as far as I'm concerned, a medicine only works if it does one of two things. One, it should stop progression of the illness. It should stop the illness from getting worse to the point that they require ventilator support. Two, it must reduce mortality. In other words, it must save lives. And so far, all the evidence that we have says that remdesivir does not do either of these things. Remdesivir does not reduce the chance of the illness progressing to the point where you need a ventilator, which is a very important endpoint. Remdesivir does not save lives. Now, I cannot emphasize this anymore. I know there is so much concern among attenders of families running around trying to source remdesivir when clearly we know that remdesivir does not save lives. There have been a lot of studies done on remdesivir. The biggest one is called the Solidarity Trial. It enrolled thousands of patients from 30 different countries at least, and it was backed by a reputed organization, WHO. And the conclusion from this study is this: remdesivir does not stop the progression of illness. It does not decrease the chance of you ending up in ICU and needing ventilator support. It does not save lives. So please stick to practicing science, which is very clear on the medicines that work. The medicines that work predominantly are steroids and drugs that reduce the clotting in your blood. These drugs are widely available. There is no shortage for these. And these are the ones backed by science. And these are the ones that we should be using in these patients. Remdesivir is overrated and overhyped. Please let us use only the drugs that are proven by science to be effective. If at all there is any benefit in remdesivir, it may reduce the duration of illness by a couple of days at most, and it may be used in people who are in hospital and who need a little bit of oxygen. Once again, remdesivir does not work in the sickest of sick patients in ICU. It does not work in people who do not need oxygen. It may be used for slight decrease in duration of illness for people needing a small amount of oxygen, and this is the only group who may benefit from this. Let me emphasize once again, remdesivir is not life-saving drug. Take care, everyone. Stay safe.
So this was Dr.
Hello, everyone.
Sridhar from Kaveri Hospital. So I think you can stop this here. So you have seen that remdesivir is not required most of the times. And in any case, if it has to be given, it has to be given only to the moderate cases who are on oxygen and they are in hospital, strictly as per advice of the doctor. So I have now shared some UK experience that we should learn from. So this was the lessons they have shared. A doctor has shared some lessons from the second wave. So he says that 99% of the COVID positive recover on their own. There's no need or benefit in giving plasma, remdesivir, ivermectin, hydroxychloroquine, antibiotics, or even steroids, blood thinners, or tocilizumab to these 99% cases. And there's no need for hospitalization as long as the oxygen level that is above 90. He says 93, but we consider it as 94%. Next. And all our medical resources, hospital beds, oxygen cylinders, etc., need to be saved for those who are only severely affected, and not for those people who are with mild cases, the mild symptoms. And for the 1% that have severe illnesses, the only medication that have been found to be significantly benefit are steroids and blood thinners. So that tocilizumab also has been found to have benefit only in 4% of the cases, those who are hospitalized, and should be given only whenever it is available. Okay. However, it will be wrong to call either of them life-saving in COVID. So no medicine has till date been said as a life-saving. So the best thing is, in mild cases, you have symptomatic treatment and you have off-the-counter medicines. And for severe cases, the steroids, oxygen, and that blood thinners, they are the mainstay of the treatment. Next. So plasma, it has been extensively studied. It should not be given. It gives us a significant amount of resources with no benefit. It uses up a significant amount of resources. But in India, we have been using plasma, but till date, there's no confirmatory study that it is much helpful. So serious medical organization in the world found any benefit in giving them and should not be given. So hydroxychloroquine and ivermectin. So these are also to be ruled out. Oxygen shortage, there is often a tendency to turn oxygen flows to the highest level possible. This has to be avoided by the doctors. Vaccine, after the vaccine, we have hardly any hospital admissions and almost nil new ICU admissions. So this is UK experience. So however, this also has been due to the serious nature of the lockdown. So because the lockdown in UK is strictly implemented and not in our case. Next. So this is all from Dr. Nitish Sood. He's a anesthetist and a critical care specialist in National Health Scheme of London. So 99% of the COVID positive who do not need oxygen were not hospitalized in UK. Once someone has tested COVID positive, there is no need. This is important. Once someone has tested COVID positive, there is no need to get retested to see if they are still COVID positive. This unnecessary retesting results in wastage of testing resources. Once 2 weeks of home isolation following date of onset of symptoms is complete, a person is considered COVID negative and non-infectious. So I think that answers our question that isolation maybe 14 to 17 days if you just want to be sure about it, maximum 17 days. And so no retesting is required. Next. So now I think it is important to talk about vaccinations. So as you know, we have two types of vaccination, Covishield and Covaxin. So which COVID-19 vaccines are licensed in India? So as I told you, one is from the AstraZeneca Covishield and one is from the Bharat Biotech, that is Covaxin. So why the question is normally raised, why vaccination is not provided to children? Because children, they have either asymptomatic or mild infection, and currently available vaccines, they have not been evaluated for children. So that is why. So it is only approved for 18 plus persons. What is the dose schedule of both the vaccines? So earlier it was said that 4 months gap should be there. Now it is said that about 6 to 8 weeks gap should be there. For Covaxin, it is 6 weeks, and for Covishield, it is maybe up to 8 weeks. So 6 weeks can be, to be on safe side, we can have gap of 6 weeks. Next. So can a person presently having COVID-19 confirmed or suspected infection be vaccinated? So infected individuals should defer vaccination for 14 days after the symptoms resolution. That means as soon as you are out of the isolation, maybe 14 to 17 days, so after that you can take that vaccine. So if you have taken first dose, then you developed COVID, so wait for another 14 days and then you just go for that vaccination. But 6 weeks gap should be there between the first and the second dose. That is minimum required. So is it necessary for a COVID-19 recovered patient to take the vaccine? And if I had COVID-19 infection or was treated, why should I receive the vaccine? So even if you have recovered and you have some kind of antibodies in your body, but you must take the vaccination after recovering. And as I told you, just wait for 4 to 8 weeks after recovery from the COVID symptoms before getting the vaccine. So this is the maximum you can, take the gap for between the first and between the COVID infection and the dose of the vaccine. Next. So what are the contraindications? There are very few contraindications, as I told you, not to be given to children below 18. If there's any serious anaphylactic or allergic reaction after the first dose, then it is contraindicated. In pregnancy and lactation, because no studies have been performed on during pregnancy and lactating mothers, so it should be avoided. So provisional temporary contraindications are, in these conditions, COVID-19 vaccination is to be deferred for 4 to 8 weeks after the recovery, as I told you earlier also. Acutely unwell and hospitalized with or without intensive care patients, they also should not be taking this vaccine. Next. So the health ministry has advised caution in vaccinating person with a history of bleeding or coagulation disorders like hemophilia. How does the person know if he or she has a coagulation disorder and what tests should be taken? So there are some tests available. So you can ask your laboratory technician, so he'll let you know. But if you know about the hemophilia or any bleeding disorder, then you must surely avoid taking this medicine for some time. People with heart and brain disorders and are on blood thinners like aspirin and antiplatelet drugs, they can continue with the medicine and have the vaccines. For them, vaccines are absolutely safe. So some people, they think they are taking aspirin and some blood anticoagulants, but it is absolutely safe for them. So are there any preventive measures and precautions that one needs to follow at the session site? So because anybody who has been to the vaccination center, they all know that the people there ask you to wait for at least half an hour. And if there is any kind of discomfort or uneasiness, even when after going home, you must consult the doctors, right? Remember to continue following key COVID-19 precaution behavior like wearing a mask, maintaining hand sanitization, and physical distance that has to be maintained even after proper vaccination. Next. So do I need to use the mask? As I told you, you have to wear mask even after getting the vaccination. And how long I will remain protected? So it is yet to be determined. So you never know whether it will last for 6 months, maybe 1 month or 1 year. It is no studies have been confirmed because it is a very recent vaccine. So can patients with hypertension, diabetes, or other comorbidities take COVID vaccine? Yes, they must take, but they must continue using their medicines. But if somebody is seriously ill, then you can defer the vaccination. Next. So if you are interested, so this is the comparison between the two vaccines. Yes, you can play the video.
There are two vaccines currently being used in India against COVID-19. One is called Covaxin and the second one is called Covishield. Here is your full guide to what are the similarities and differences between both these vaccines. Let's talk about the platform first. Covaxin is an inactivated vaccine that has been developed by Hyderabad-based Bharat Biotech International Limited in collaboration with the Indian Council of Medical Research and National Institute of Virology in Pune. It is based on a tried and tested platform of dead viruses. The vaccine is developed using a whole virion inactivated viro cell-derived platform technology. Inactivated vaccines do not replicate and are therefore unlikely to revert and cause pathological effects. They contain dead viruses, incapable of infecting people, but still able to instruct the immune system to mount a defensive reaction against an infection. Covishield is based on the viral vector platform. A chimpanzee adenovirus called CH80OX1 is the vector that has been modified to carry the coronavirus spike protein into human cells. While the injected cold virus is harmless, it serves as an instruction manual for the body on how to fight against similar viruses. This platform is used for infections like Ebola. As far as the dosage regimen for both are concerned, both of these vaccines follow a 2-day vaccination regimen given 28 days apart right now. Both vaccines do not require sub-zero storage, no reconstitution requirement, and ready-to-use liquid presentation in multi-dose vials stable at 2 to 8 degrees Celsius. The efficacy data of Covaxin is now available and it has just been released. The company says the interim data shows 81% efficacy. The trials are still on. Efficacy percentage of Covishield is at 70%. Covishield is approved for restricted use in emergency situations that may prevent COVID-19 disease in individuals above the age of 18. Covaxin has received restricted use authorization in a clinical trial mode. Both vaccines do not have a market use authorization clearance yet from the Drugs Controller General of India because both of these vaccines are still in the phase 3 trials. The vaccines are being administered free of cost at government hospitals and health centers, while 250 rupees is being charged for it at private health facilities.
So next. So as far as the amount is concerned, I think now the position is changed. So you may have to pay more for the private vaccination. So Dr. Sonu, will you tell us the carry-on messages? Dr. Sonu, are you with us?
Yes, I think, yes.
Yeah.
Yes, so I think the presentation was quite comprehensive and almost every query, which I presume is being answered. Just two things about the vaccine, because there has been a fear about whether we should take the vaccine or not. And the vaccine, if vaccine is not 100% efficacious, so why we should take it? So none of the vaccine, be it any vaccine which we have, so none of the vaccine our childhood vaccine, is 100% efficacious. So this vaccine is 60 to 80% efficacious, depending on this. The only thing which they can see by guarantee is after vaccination, you will not have severe reaction of severe disease. And that is really important. You may have COVID. 30% of people who are having vaccinated may catch COVID, but that COVID will not lead them to ICU. That COVID will not lead them to severe death or disability. So this is one thing why we should take vaccine. Second common thing is why we should wear mask when we have vaccine. So one reason I have already given that they can be infected, although not to very severe extent. But the most important reason is they can transmit the infection. They can be infected, and by not wearing mask, they can transmit the infection to that person who is not vaccinated, and that person can have a severe infection. So that is why the wearing of mask by a person who is vaccinated is really important. So I think these are some of the things. And one question which has been posed in the chat section, why we should not do test twice or thrice when they are not very specific. You are right to some extent that these tests are not very specific, because a test which is positive may come negative, or a test which is negative may come positive. But after 2 tests or after 3 tests, what is the guarantee that the test will again not come negative or positive? So there is no guarantee of it. So that is why it is 70 to 80%. Again, like vaccine, the tests are again 70 to 80% specific. So this means that it is able to diagnose much more number of cases. So it's always better, like if the tests, if you are giving, if the test is given positive result, so one should isolate. One should isolate. And if it is giving negative result and you are suffering from symptoms, then isolate yourself, wait for some time, like maybe 2 to 3 days, and get test again done. So I think these are some of the things which I wanted to say, and maybe we can invite some questions if somebody have from them.
And Dr. Sonu, this is a very simple thing. I'll carry you a message. It is Sachdeva. You just remember Sachdeva. It is social distancing. Always wear double mask. Crowds to be avoided. Hand washing. Drink plenty of fluids. Exercise regularly, including pranayama, vaccination, and avoid unnecessary traveling. So you can remember this. And what is the next slide, Ashdeep? You can skip this. You can skip this. No, next. No, you can skip this. Dr. Sonu, there are some queries about the diet also during and after the COVID. So can you just read along the 2 slides? They're just 2 slides.
Yeah, I think I will just give you general advice. Maybe Dr. Rakesh, you can further go through the slides. So general advice is, main thing is the objective while being in COVID is to increase immunity. Because if your immunity is poor, then you are more likely to catch COVID and even severe infection. So the main thing, all the things which increases immunity is important. So for that, like people used to have warm water. So now even when I go to my hospital, so I always carry that warm water. I think warm water, and you can put elaichi, you can put long into it, and these things you can put into this. So this is one thing. Just take sips of warm water in between. So hydration is really important, even for a normal person. Second thing is eating of food. Again, hydration, it is also linked with hydration. Third thing is like vegetarian. It is seen that those people who are vegetarian are less prone to suffer from these diseases. Although this is not proven, but those people who are vegetarian, they have seen that they are less likely to suffer from COVID as compared to non-vegetarian. So I'm not saying those who are non-vegetarian should leave that. But yes, some studies have documented that. Smoking and alcohol. Smoking is really dangerous, as Dr. Rakesh has already told. So you should not smoke, because when you are smoking, we have like there is a very large study conducted in China at that point of time. So they have seen the patients who are in ICU. They have interviewed them. Out of them, those patients who are ICU, most of them were smokers. So smoking increases the morbidity. And then I think vitamin C, zinc, these are again important. You can take lime water, or you can take vitamin C tablets. So I think this is what are there. So Dr. Rakesh, do you want to add upon to it? This is
Yeah,
what
I think we can, as I told you, that hydration is important. So you must drink at least 10 glasses of water, and you may opt for either Nimbu Pani, or that ORS solution can be used, and coconut water is really good, right? And there are these all the details about the diet there. We'll be sharing this recording with you, so you can just go through it. So next slide. So this is after the COVID. So they recommend, there's a dietitian, Chavinika, who recommends recovery laddu. Prepare a laddu with mixture of dry fruits, white sesame seeds, kalonji, ajwain, all roasted in desi ghee. So these are some of the recipes you can definitely try, and they should be good. They are homemade remedies. And advice for caregivers is same good diet, breathing exercises, good hydration, and you should take good sleep, at least 6-7 hours in a day. So next. So I think we have covered most of the queries, but still, if somebody wants to ask any question, so we have seen the chat in the chat box. I don't think there's any question which has been unanswered. And in case you have any queries, you can see this recording repeatedly. We'll be sharing tomorrow after editing, and you'll benefit. And rather, I'll request you to share this presentation with or the recording with all your friends and relatives. So anybody, if he wants to say anything. So there's a question, if somebody is positive after the isolation. So this is the question. I think then you need to get all the tests done, the laboratory tests also, that D-dimer, and there are some C-reactive protein that you can undergo. But I don't think even if it is positive, it really matters if you isolate yourself for another 5-7 days. And if you are asymptomatic and your oxygen saturation is more than 94%. So I don't think there's much to worry about. So any other question? So from Harjot, how long someone can take zinc and vitamin C? Once or twice and for a month? I think for a month it will be okay. But otherwise you can take those some Ayurvedic prepared like Chyawanprash, you can take maybe for more time. So they are natural things, and you can take lemon water, you can take amla. These are natural things you can definitely take. Acha, for asthma, I just wanted to tell you about the patients who are having asthma. Because asthma that involves, that affects lungs. So anybody having asthma, they have to be very, very careful that they have to treat infection. If in fact the the bronchodilators, they have to be taken. And if there is infection, then antibiotics are to be taken. And definitely, if they fall ill, the doctors there need to be more careful about it. Any patient having chronic obstructive airway diseases of any kind. So fever, I'll say 98.4, which is normal, but for up to 99, I don't think crocin is required. If it is about 100 degrees, then crocin is indicated. But in case of COVID, if you are symptomatic, you can take it 8 hourly. No issues in that. If you want to ask any question, you can unmute yourself also. So till date, I have not found anything that prohibits patients of epilepsy from taking vaccination. So I have not come across any data, but if I get a data, I'll share with the Ms. Nidhi or Mr. Bhupinder. So I think they will inform you. If I get across a data regarding epilepsy and vaccination, I'll let you know.
Dr. Rakesh,
Yes, yes.
one more thing regard to epilepsy, people used to say about rheumatoid arthritis or those who are autoimmune disorders. Those people who are
Okay.
autoimmune disorders. So what should be done for vaccination? So again, I think it is recommended that vaccination for them should also be done and the drug should not be stopped. So their drugs should not be stopped and they should be vaccinated. Some of the antibodies will be built even in the autoimmune disorder. So this is recommendations and one should not be, the drug should not be stopped.
Yeah. And there was another question about vaccination under 18 years that is not recommended because no studies have been done to see the safety of the vaccine, right? So it is better not to take that, not to vaccinate children below 18 years. So anything else? So I think if there are no more questions, we can, I think, leave. And but sodium. There's a question I said in presentation: sodium hypochlorite be used for disinfecting cloth masks. What is it's common? Sodium hypochlorite you can get in the market. There's no issue about that. I think you will get it in the market. So I don't think there is any question unanswered. But still, if you have questions, you can just pass it on to Mr. Bhupinder, Captain Atul, or Ms. Nidhi, and they'll send it to me also. So Deepthi, she says that they have rumors that vaccine affects pregnancy if someone wants to plan. Is that so? So we have not come across any kind of a study that has been done on people who are pregnant. Now, for already pregnant, and for lactating mother, it is no. But I don't think it affects if in future you want to have a pregnancy. I don't think it will matter much. But still, if I come across a study, I'll share it. So if there are no more questions, then I think we can leave. So thank you. Arunji, will you like to say something just to wind up?
No, thank you. It was a really an exhaustive and a very informative presentation. I think Dr. you and Dr. Sonu Goyal has almost touched each and every point. The lot of queries which everybody, a layman like me, can have in his mind. And now from now onwards, I mean, all those participants, they'll be very knowledgeable on this subject. And most of the queries have been answered. And I request all the participants that once you again see this, audited video, which we'll put it online tomorrow, you can raise as many queries as like, and these will be answered by Dr. Sonu or Dr. Rakesh subsequently as well. Thank you so much for your participation. Thank you so much, Dr. Rakesh and Dr. Sonu Goyal, for your contributions. And thank you, Arshdeep, for making contribution and doing this presentation a success. Thank you so much, everybody.
So thank you, Arunji. Thank you, Dr. Sonu, and thank you our team, Arshdeep and Anuj. And thank you all who have participated from Trenta. And there were people who were not in there otherwise also. They have also attended. So thanks a lot. I have shared this Zoom link with some journalists also. They might have also attended.